He's a rare blend, and rightly so. He has honored with his presence on the Silver Jubilee celebration of Father Muller Homeopathic Medical College. He has not used an escalator. He has climbed the steps of success. And every step he has taken with consciousness. He did his M.B.B.S from Grand Medical College, Mumbai in the year 1982. And it is M.D. Chest from St. G.S. Medical College, as K.M. College, K.M. Hospital, Mumbai in the year 1987. And it is B.H.M.S from Sri Chamunda Mata Homeopathic Medical College, Jalgaon in the year 2012. He is an epitome of learner. He did his M.B.B.S, then chest medicine, and then homeopathy. It's a rare blend of all these qualities. I know people will ask for certification, and he has certification of all that. He has done fellowship course in medical yoga from Maharashtra University of Health Sciences, Nashik, correspondence course in alternative medicine, practical training in meridian correction therapy, certificate course in Reiki, certificate course in medical astrology, certificate course in diet therapy, and he has a rich experience of working in hospital. You know, there was a time I only knew the name of Jaslok Hospital, which was very famous then, and we have a person from that particular place. And H.N. Hospital, Mumbai, Maharashtra. He was a resident doctor, general medicine and cardiology in the year 1983 and 84. Worked as a resident in the Department of Cardiology and managed ICU of general and heart emergencies. He was in K.M. Hospital, Mumbai, Maharashtra, and adorned multiple posts from 84 to 1990. Worked as a lecturer in the respiratory medicine involving training of M.D. Chest residents 1988 to 1990. Worked as chief resident and in charge of intensive respiratory care unit and handling additional charge of fiber optic bronchoscopy department from 1984 to 1987. Honorary TB expert to several TB hospital, also worked as a research officer at Environment and Air Pollution Survey Department of Mumbai. Associated HOD and respiratory medicine in treating victim of Bhopal gas poisoning and wrote research articles then. R.N. Cooper Hospital, Mumbai, Maharashtra, register in intensive coronary care unit, and Hahnemann College of Homeopathy, United Kingdom, mentor and PG guide from 2013 to 2015. A research guide to adjuvant treatment in homeopathy for moderate to severe cases of COVID-19. I know COVID has created havoc, but some it has done good, and the beneficiary of that is Dr. Patil. Established an advanced nursing home for intensive care management involving respiratory and cardiac disease. It is Deep Ganga Nursing Home and ICU, Jalgaon, Maharashtra. He is the founder and chief of that institute. Introduced temporary heart pacemaker implantation in Khandesh region and consulted on cases involving cardiogenic shock, complete heart block, and multi-organ failure cases. Deep Ganga Total Health Solutions, Mumbai, Maharashtra is a chairman and established the Total Health Solution with the aim of treating patients with holistic approach. little patient because it runs in pages. I think I must do justice to that. Works as an integrated practitioner focusing on homeopathy and allopathy for treating critical cases. We are indeed very fortunate to have him here because he'll be discussing on those cases. Deep Ganga Research Foundation. He is SIRO certified, Mumbai, Maharashtra. He is a Chief Research Officer. He's got quite a list of research and contributions. The list goes, it's pretty long. I will not be reading that and test your patience. But he is the advisor for syllabus homeopathy course, Maharashtra University of Health Sciences, and making his contribution over there. And he has many lectures at seminars and conferences. There are quite a few listed. And amongst them, some of the important ones are 66th World Homeopathic Congress, LMHI, New Delhi 2011. Then International Convention in Delhi 2016. Then International Conference of Integrative Oncology at Nasik 2017. And at Rajkot National Homeopathic Awareness Summit 2019. International Conference of Integrative Oncology at Kochi 2020. And Scientific Conference on World Homeopathy Day by CCRS New Delhi in 2021. All India Homeopathic Scientific Seminar Aurangabad 2022. And Scientific Convention on World Homeopathy Day by CCRS New Delhi in 2023. He has awards and recognitions. He has got appreciation and recognition from Provincial Parliament of Canada for presentation of COVID-19 treatment, and is awarded Samman Devdutancha 2021 by the Health Minister of Maharashtra, and awarded Champion of Change Award Maharashtra 2020 by Governor of Maharashtra. He has got list of associated institutes and organizations in the past. Some significant of them is Sir J.J. Group of Hospital Mumbai, GT Hospital Mumbai, Harkishan Das Hospital Mumbai, Jaslok Hospital Mumbai, KM Hospital Mumbai, Cooper Hospital Mumbai, Primary Health Center, Care Center Khardi, Civil Hospital Jalgaon, Associated Acupuncture Science Practitioners, is a life member. Social Activities, a Rotary Club, Maharashtra Medical Council, life member, Indian Medical Council, Indian Chess Society, A.H.M.S. Delhi, Homeopathic Medical Association of India, he is a member. He has list of publications featured in Times of India, Lokmat, Zee News, Sakal Times, TV9, Mumbai Mirror, India Today, Gujarat Mirror, Akila News, and then he will be in the news at Mangalore. Sir, it's an honor and privilege to have you here amidst us. On behalf of all the delegates, and on my behalf, we extend a hearty welcome, and we are indeed happy to hand over the floor for your deliberation.
Thank you, sir.
I now request Dr. Rita Chakraborty, Professor and HOD, Department of Repertory and Homeopathic Case Taking, to welcome our speaker with a floral bouquet.
Fellowship in Medical Yoga. He is a researcher, speaker, teacher, and an allopathic fellowship. Introducing our speaker for RAJATHOTSAVA, Dr. Jaswant Patil, M.B.B.S, M.B.S, B.H.M.S, M.A. Alternative Therapy, and Fellowship in Medical Yoga.
Hello. We go to the slide presentation. First slide. Hello friends, very warm welcome to you. And I've come to know that you are all intellectuals of Father Muller Homeopathic Medical College. And I specially come for you people because I know that 100% you will be the homeopaths. But I'm going to talk something different, which will ignite your mind. And it's left to you to think over, because everyone is intelligent here. And one has to think by his mind, by his rational, and by his logic. Accept everything that applies to your mind, and you realize in your field ground the results. Homeopathy is a wonderful science, but there is more art in it, and art is not everyone's cup of tea. So many times I've seen undergraduates leaving homeopathy, getting a degree and following allopathy. This has to be because to produce the same results with the same medicine in different all type of patients, many times it is not possible. And that's the reason that discourages the students. So, to come here for the RAJATHOTSAVA of Father Muller Homeopathic Medical College, celebrating 25 years of PG course in homeopathy, I talked to all the dignitaries, fathers, and principal sir. I decided, because I wanted a break from this continuous presentation of seminars, conferences, webinars. And that day I said, now for at least 4 months, I'm not going in, I'm concentrating in my work. And your loved principal sir called me and requested me, please come sir. I said, what to do? I listened. He said, it's an institute which is par excellence in India. And all the students are postgraduate students. And if you give something, it will shape their life and shape a homeopathy. I said, I can't say no. And I accepted the invitation and came here. Homeopathic approach in management of incurable complex ICU cases with homeopathy alone. I am talking with homeopathy alone. And in some cases where we are called in or we do not have some important facilities for the life support, integration with the conventional medicine in an apt way. Not haphazard. There has to be a reason, there has to be a direction. And now today, we have to be in the scientific world. It's not an art world. Because reproducibility of the medicine and the result in the cases will take you ahead. Otherwise, people will throw you out. I'll share my experience, my life. She has given a very big introduction, but I'll give you a brief introduction. I was a staunch allopath, very staunch. When allopaths talk against homeopathy, it's not their fault. Even I was one of them. I was more egoistic and talking more. Means if patient used to come and say, sir, I was taking these medicines, homeopathic pills. I said, what nonsense. The world is going on the moon and you are still in the hell. And you people spoil your health by taking all these medications. Ayurveda, Unani, homeopathy. And then come to eat our head. We have to bloody stay all night awake for you. You go to hell. I used to throw the medicine. That ego was there. Because that allopathic knowledge is so strong to the base that shapes a doctor into a robotic doctor. Hardly 10% are there with an open and broad mind, they will accept. Even allopaths, they come to us. But the mindset is very different. So I worked for 5 years into an intensive care unit. ITCU, IMCU, ICCU, ICU, IMCU. For respiratory medicine, I was in charge of bronchoscopy and ventilator management. After pulmonology, and half part before pulmonology, I did cardiology. And then again completed with the training of putting a pacemaker, temporary, in a heart. It used to take me 3 minutes to put in a heart a temporary pacemaker to save the life. And fees was, in that time, 50,000 rupees. Who would give in homeopathy 50,000? No one will give. Because we have rated ourselves very low. We can do greater than that. You will not require only pacemaker. With just the simple pills. I am going to show you that. And this has taken homeopathy down. Now, it's the most sound and most powerful dynamic medicine without side effect. I say it is without side effect. And why? If somebody asks you, why no side effects? Because we say, you give it to laboratory, there is no medicine in it. Then when there is no medicine, how can it give side effects? They don't understand there are nanoparticles. And nanoparticles never give side effects. Because their impact, it precisely goes to the root without damaging other cells. And without doing anything, they cure. And that is there in Ayurveda also. Sahasra Koti Bhasma means diluted crores time. That means putting into this. What are the principles of Ayurveda? Vat, Pitta, Kaphs. In homeopathy, Sora, psychosis, syphilis. I feel Dr. Hahnemann must have read. And he had said, use your logic, available knowledge in the universe, and with your intelligence, produce something new. He has already said. And that is how, because he was broad-minded, coming from allopathy to finding new. Why he left practice? Because that time there was no good treatment. For blood pressure, there was bloodletting. Patient used to die by anemia. Had this today's state, Dr. Hahnemann would have survived. He would have changed the whole scenario. But we are stuck in a circle. Again, like an allopath, we homeopaths are also like that. Not trying to change, not budging an inch, having the fixed ideas and prejudiced mind. When I broke that, when my mother was sick, she was serious, multi-organ failure, dying in my ICU. Last steps were there. And I had talked to all of the world's my colleague. There was no remedy left in allopathy, conventional medicine. And finally she deteriorated. For her, I left Mumbai. I wanted to go to US for further studies after my post-graduation. But love for my mother was so extreme, I came here. I was crying in front of God with the tears. There my ego broke. Now what is there? Nothing is left. Everything is gone. And I just turned my around and saw Kent's Materia Medica, given by my friend. I said, God is always, He wants to show you the way. You will get some indications. Some indications. I do not know how that book was lying there. Because I had opened up 10 times, I said, what nonsense. There is nothing systematic written like allopathy. I closed down, and that day I had opened. And I was reading, first medicine came R-Iode. And it was fitting in clinically. The mind and all those, I was not knowing that time. I said, there is no way out now. What to do? Finally, I called a homeopath. He came. And she's in an extreme state. Everyone doesn't dare to treat. I said, what, you are homeopaths? I am telling you, I know my mother is going to die. Give. No, sir, we will not touch. She is your mother. I said, I'm not a great person. People understand that allopath is a great person. No, he's like a human being, common man. Then I called my relative in Banaras. He's M.B.B.S. and homeopath, Dr. Vijay Singh. Sir, kaisa do ye dawa? From where I should get it? Well, you go to, there is medical store, I got it. 1 or 2 globules, dissolve in a cup of water and give only 1 teaspoonful. And repeat if required. What nonsense, 2 globules and such diluted, what the hell it can do? I was scratching my head, but I was caught. It was a checkmate situation and I had no choice than to trust it. I said, okay. I put in the 1 teaspoon, she was not conscious, so not swallowing. She should not swallow the water in the trachea. So small quantities. 10-12 bund, 10-12 bund. I knew that now she is going to pass. And for 3 days I had not taken bath. I was sitting next to her, monitoring a minute to minute. I said, at the end, if she passes in our Hindu rites, we have to keep her head on our thigh, the eldest son. So I took a fast shower and came back and saw the monitor showing stability of the heart rate. Pulse was coming up, BP was coming up. And finally, I saw the positive response. You know, vitality improves, the face improves, there is a glow. And I say, my God, ek bund can do such a great wonders. And finally, 24 hours, she stabilized hemodynamically. 48 hours, she was out from the medical gadget supports. And 72 hours, she said, beta khana khilayega. Miss appetite comes. And that too in such a serious patient in 3 days. I thank God. You have shown me the gold mine. I went to my dad after the whole, she came up and everything. Dad, I want to be a homeopath. Are you fool? Are you fool? You want to be a homeopath? Do you know what is the value of homeopath? I said, I don't know. He said, if you go to marriage, people will say, if you show that you are a cardiologist, pulmonologist, ऐसा कुर्सी साफ करेगा. आओ सर बैठो बैठो बैठो. होम्योपैथ वो उधर बैठ जाओ. ऐसे we are not born as a doctor for the respect and a status. We are born for a patient. And today my ego has broken. And I will be shifting to homeopathy gradually, not suddenly, because I had a roaring practice of allopathy. I was the only doctor in whole of the Khandesh putting pacemaker in the heart with fiber optic bronchoscopy investigations. So if the whole Jalgaon state used to depend on me, then I said, at least we start trying. And finally, he saw me that I am going towards homeopathy more, reducing allopathy. He said, do you know what you are doing, blunder? You are giving the gold mine, leaving the gold mine and going in the coal mine. कोयले में तेको क्या मिलेगा? What you will get it coal. So I thought, what to answer. I said, Dad, I may find a diamond there, and that diamond is homeopathy. That diamond is homeopathy. And I tell you, I don't want to blame any science. Every science is good. Every science has got scope and limitations. The same limitations started coming for homeopathy also. Then I started searching other sciences. Unani, Ayurveda, 116 sciences I searched. I said I should not leave a stone unturned where it will be used when homeopathy doesn't work. So I started using homeopathy, giving one prescription of 10, 12, how allopaths write? खांसी आता है कफ सिरप, दर्द होता है कॉम्बीफ्लाम, भूख नहीं लगती सिट्राल का, अल्फा अल्फा, I forgotten the name also now. And whatever one symptom medicine, one symptom medicine, one symptom medicine, and one dose of homeopathy. I was ashamed to give homeopathy, even though I was convinced homeopathy is the best. And that also happens with other allopaths. So I started giving it water. Dissolve 2-3 globules, make a water. And the name I kept as JD dose. What is this medicine? JD dose. Jaswant Patil. So JD, my father's name and my name. And people used to come and say, कि सर वो पानी वाला JD dose is very good. How? बोले moment you put on the tongue, the next minute you start feeling better. So I was saying, oh, but I was not knowing any principles. There is Organon book of medicine, that also I didn't have any knowledge. I had purchased one clinical book by Dr. Tandon from the Reader's Digest to say, what is homeopathy? Who will teach me? But you have to learn by yourself. And diagnosis, 3 medicines. And what out of 3, what characteristics were fitting in? Give 1 dose that, 1 dose this, and whole prescription. Oh, OPD started increasing. 15-30 patients were there in allopathy. And suddenly it rose to 150 patients per day. And my indoor from 20 bed to 0 to 1. That is IPD, inpatient. ICU, only some cases who were not from my patient's pool. Otherwise, doctor gets from the patient pools. The inpatient as well as serious patient. Finally, I said this water dose is making some magic. And I was thinking why my inpatients are decreasing. So one of the asthma patient who was getting admitted 3 times in a year, finally, I saw, Arey, this year you didn't get it. Sir, wo JD dose pani wala. That is making my, I put it here, I go down, descend your stairs down and feel my chest is clear. My breathing has become more open. Then I said, why I am giving Derifylene and these inhalers? So I said, I'll stop this and see. I stopped it. And he was getting relief and continued. 1 dose, all other placebos. And finally the allopathic prescription 0 to 1 like indoor and homeopathy full. I was getting results. Because earlier allopathy was there to help me out by chance if something fails. And finally I decided to change. And to improve my confidence, I don't know whether I was a homeopath, if there is a second birth or third birth, because it is to click me. A patient came with complete heart block, inferior wall infarction with complete heart block extending to anterior wall. It is a serious condition. No one survives in allopathy. I worked in ICCU. Unless you put in a pacemaker and do lot of things. I said, you have to put a pacemaker. We do not have money. He went away. All the relatives ran away. The patient was in my ICU. Now what to do? Everything in allopathy was not working. So I scratched my brain and said, now there is no alternative. As if somebody was pushing me. That was my first ICU case. Gave him Arnica 30. Arnica 30, because I had read, Arnica stabilizes all the dying cells. I said, at least I will preserve the myocardium. And it works as an antithrombotic also. That time streptokinase was 10,000 and urokinase was 25 or 30,000 in 1994. And we were used to use sorbitrate for coronary angiosperm. So I gave him Cactus G6C. Not very frequent. I said 2-3 times you give. I told my assistant, these 3 homeopathic medicines will do or no, I do not know. I am using for the first time. But you keep on giving. I am going for a practice in the nearby village. I'll come back. By that time, he is surely going to die. I wrote a death certificate. I am sorry to do that. But I wrote that certificate because if he dies, they want body. And in 1 hour's time, I cannot come from that place to sign. So I wrote everything except for time. I told assistant, कि if jata hai, 1 hour, you should not leave the body. Never hand over the body to the, that was taught to me in my allopathic days. For this person, I told him, if he dies, declare and say, don't give the body. Otherwise, if they take immediately to crematorium, the body stands because of muscle spasm, even after death. अरे जिंदा आदमी मरा नहीं था, उसको जिंदा जला दिया. Doctor gets blame. When I came back, there was only one dopamine drip with 5 microgram per kilogram per minute drip. We didn't have that time NORADs and all those. His person, I came and saw. I said, first let me go to the ICU in my hospital, nursing home. This person was eating dabba. I said, what nonsense? I said, get the ECG machine. Complete heart block gone. Without pacemaker. Complete heart block gone. The ICU, means you will not believe me, the hyperacute changes of myocardial infarction becomes isoelectric, as if he didn't have any heart attack. Unbelievable, unbelievable for me. That was a second lesson that homeopathy can be integrated into ICU. So I took an ECG. I said, take a thumb impression on this, both. Because no one outside will believe me. They will say it's all fake, false. No one will believe, and ultimately I'll have to face problems. So like that, there are so many cases I have dealt in. If I tell you the whole story, it will take over a day. So let us come to the point of presentation. She is my daughter, Dr. Aishwarya. She is doing her MD in dermatology. And I am going to talk about her, why she is here today, and what she has done to homeopathy. She was also not in favor of homeopathy. Thank you. So let us come to the point. I always salute our Grandmaster who has shown the world a new way. And what he has given to us, we cannot and we can never forget him. And because of him, today we are all there, and so many patients are surviving. So many lives have been saved, out of which I am the one. That I am going to share you. How is that? RAJATHOTSAVA. We always say, but we never act, only say. And that is how this introduction. This is a cricket. Australia versus India. South Africa versus India. They called me as a allopathic doctor. Dr. Manoj Kumar was me. I gave children toothache, half Combiflam, only half Combiflam, because next day was a match. One simple doxycycline, that is very low antibiotic, Heparsulf, Silesia, and Belladonna. 1M, and 30. She was so fine within 2-3 hours. Next day we saw the match because we had to stand in the ground. And she was hitting sixers, 4 and 6, 4 and 6. तो मनोज कुमार सर ये क्या हो गया? मैंने कहा बेलाडोना का कमाल है, बेलाडोना का कमाल है. बोले what will happen to India? I say I do not know, but homeopathy will get a victory. And finally, India lost, South Africa won. He was saying, sir, you are responsible. I say, I am a doctor. I don't differentiate any caste, creed, religion, any God. You are a human being. You have to act. And that is why I showed this. Even in the sports medicine, there is a scope. Even in the sports medicine. And we are going to, I am going to talk about sports in some other sessions. But homeopathy is a vast subject where homeopathy can come into this. Today, India 62% people are taking homeopathy, and there is a bright future provided we act fast. During COVID time, I think before that I was working in a low profile. Hardly people were knowing me what I am doing. I had gathered a lot of patients. But during COVID time, one of my patients who was a superintendent of police, can we do for our police something? Sir, please tell me. I said, I'll do, but I want a sincere approach and clear-cut approach. No allopathy, only homeopathy for prevention. So 100 battalion were given arsenic album 200, repeated every week. Every week. And both battalion, they went to a same hotspot, and after 10 days, those who were given arsenic album 200, only one developed COVID, we was corona positive, and other 27 developed COVID. So there we realized what is the power of arsenic album and homeopathy. And finally I put on my Facebook and it was viral. And of course homeopathy, arsenic album has brought all of us, and that has to be done by every one of us. You get an opportunity, try to do observational studies. At least something will come out and you will come to know that these things are happening. Homeopathy as an adjuvant to conventional medicine. The cases which I have done, and many of you have done, there are so many good homeopaths. They are also doing a great job. And I am seeing they are also getting results provided the allopaths they cooperate. Many times they don't cooperate, they lose patient. What is more important? What is more important is giving the medicine in the right direction, using your common sense, rational logic, clinical experience, and RAJATHOTSAVA, that is, dare to be wise. So with this result, I said arsenic album can do wonders. So one of the patient called me, their relative, sir, isko corona ho gaya, kya kare? कोविड के टाइम पे उसको रात को फ़ोन आया, मैंने कहा क्या करूँ? आर्सेनिक एल्बम वाज इजीली अवेलेबल. take arsenic album, and oxygen improved from 80 to 90, just with arsenic album 1 dose. But then again it dropped, and they got panicky, shifted him to COVID hospital, and finally there they didn't allow this arsenic album. Now repetition. In acute cases, repetition is very important. If you don't repeat, now where is the posology? I was so confused, scratching my head here. Homeopathy, there is no direction. Which potency? Some say 30, some say 200. So many schools of thought have decided that their own potency. Who is right, who is wrong, we do not know. But I only know homeopathy works. Whether you give 30, 200, whatever is there, you get the result. I have done a lot of experiment to learn, to probe, to find out what is right, wrong. But any potency I used, I got a result. I said, isko 30, next I'll give 200. Next I'll give 1M. And it used to work. On the contrary, higher potencies used to work faster and required less repetition. That is what I have observed. But in dynamic cases, even repeated many times, have saved the people. And that is how I learned from failures. I have learned from non-acceptance. I have learned for making a blunders and people dying. So, in conventional medicine, everything, there is one doctor who is a head of the department in surgery in Pune. He said, my father is dying, can you help me? So he asked me, कि ammonia is high, what to give? Now, if ammonia is high, what to give? You require history. He said, I can give you allopathic history, but I do not know. I was hardly with my father. Father is unconscious. What happened? Now, I just asked him, what, your father has a problem with your mother or some male person in the house? I had to learn one thing. Ammonium mur from female side, ammonium carb from male side. So he said he had a problem with me. So male, ammonium carb 30, no history. Given, and the ammonia started coming down when they were doing all the hell to bring down the ammonia, and it was not coming down. So this how? Now I said I want to give a constitutional medicine. How to? Well, sir, first take him out, otherwise next hour he will die. Now he is on NORADs. NORADs means they go on increasing from 5 to 20, finally after 20, no medicine, no increase, patient dies of cardiorespiratory failure. So I said, what is the problem? Do you have any other earlier heart history, diagnosis? Nothing. Finally, Cactus G, Arnica is a patent. Ye de do. It will save. And BP started rising from 20, they brought back the NORADs to 5. Very minimum. So now, where is it this? I said, now give me some more information. Sir, still not time. He is still into a heart failure, not coming out. Moment we stop NORADs, BP starts falling down. So we have to cardiovascular shock, circulatory shock. What are the medicines? I asked 2D echo, whether it is right-sided failure, whether it is left-sided failure. If it is left and right both, digitalis works. Somewhere you have to act like immediate prescriber to bring him back. And once he comes back to the life, then the thing starts improving. With every small things, he is getting up and sleeping. Now he is open eyes, sleeping. The CNS has got blunted. While talking also he sleeps. So Carbovage and Helleborus. These specific remedies one should have. 80% of the time they will act, not 100%. Then you have to think. But there is no time to think. You have to act fast in ICU cases. So you prescribe and see the result. Many times even in allopathy we give injections, see no response, then we add dopamine, then we add this, we add that, and then get the results. So like that, you have to act. And finally he is out of ventilator, sitting, can't walk. Now he has gone into a state of paresis, not paralysis. So now which is the best medicine? Post-paralytic base. We don't have to take a history. Causticum. And finally with causticum, now he can stand with support and all those things, and she's still under my treatment. So let us see and watch. Now this is going on for 20 days. And every day medicine is given for pneumonia, for septic shock, for cardiovascular thing, heart thing. And this will maintain till the time a remedy will come, which will be a constitutional, it will show you a PQRS symptom. I am going to show one of that case, how it comes to PQRS. And that is an individualized remedy, you don't have to hunt. It comes automatically by giving acute remedies. Small acting acute remedies, and it will emerge, and then finally with that remedy repeated many times, almost daily also for 1 month or that, skin eruptions will come, or tooth problem or hair problem. And as per the Hering's law, the case will be cured. First I was thinking whether I am doing this right, wrong. This is not a principle of homeopathy. Principle is to save a person. Principle is to save a person. And Dr. Hahnemann, what was a big gap between 5th edition and 6th edition? Why it didn't come? There were a lot of controversies. If you go into the depth, I started reading why there was so delay. Somebody is saying it's a Milanese problem, somebody saying rights of the book. But Dr. Hahnemann was not for money. He had said, and then I learnt Dr. H.D. He was a pediatric surgeon. How many of you know? Raise your hands. There is no one. This H.D. was told to me by Dr. Rajesh Shah. I said, what? Well, you read him. And I read, he was a pediatric surgeon. And he took a treatment from Dr. Hahnemann, he was cured. And he was fascinated towards homeopathy. So you get information from here, there, wherever you get, you put in the time, go into the depth and see. After that, it came that there was this, he became a homeopath, Dr. H.D. And he told Dr. Hahnemann that he has mixed two medicines in one applying to one symptom, another applying to another symptom. So always whenever there is a change, there is a uproar. Everybody wants to walk like a ship in the line. Someone goes out, he may be wrong. He may be wrong. But you have to see, check yourself, verify, testify yourself. Just don't be rigid and just don't be narrow-minded. Then Dr. Hahnemann said, it's really a good idea, even I thought many times. But it's not what principles we have laid down, we should follow the principles. Because we are upcoming. And there will be a resistance, chaos in the system. So he said, Dr. Boninghausen, Dr. Borick agreed. Then he said, I will give this to Dr. Char to finally decide. And then there was a final decision, no, we will not put this in 5th edition because whatever we have laid down has gone into the minds. The learners, practitioners will get disturbed and we will think till the 6th edition. Next edition, we will think over it. And this is how Dr. Hahnemann was open. He had come from allopathy to homeopathy. He said, okay, all right, today I am doing this practice. Tomorrow I may change. There will be uproar. Like during COVID times, I took webinars. Why? Because I found out something. whenever you find out something, you should always share with all homeopaths. Because if homeopathy increases, your value and your practice will increase. Don't think your competitor comes to know about your remedy, he will give that remedy and the things will be okay. Always share. Knowledge is to share. I gave the protocols, and in protocols, there were 4-5 remedies as per indication, and I said find out an individualized remedy. See, individualized remedy don't start within very acute serious cases, because I had seen that doesn't stand, there is no support of the complementary and follows well medicine, the patient will go down. Then I gave the protocols. I knew there will be a criticism, there will be uproar. Oh, what is this is wrong homeopathy, right homeopathy. Homeopathy is just to save a life. Because of that fear, the first COVID patient that came to me, because after 20 years of my allopathic career, I had appeared as in the B.H.M.S college 4.5 degrees, 4.5 years. And it came to me, now I should practice classical homeopathy. Wonderful. I was getting results. I'll show you that also. Because I'm telling all this, because once you will start seeing the slides, you will realize what I am saying and what is going into your mind. Research has to go on. Next COVID, I didn't give the protocol. And there was a raised hand said, sir, takeaway protocol nahi diya. You're not given the takeaway protocol. I said, because there was a lot of criticism. You people are not realizing. Patient has survived. Why don't you understand? He said, we have used that rampantly. And the response was excellent. I said, have you kept the records? No. So who will believe you? So keep an habit of keeping records and then working. So we come homeopathy as an adjuvant treatment. In this slide, I have already talked to you how allopathy and homeopathy can work together. Some important facts about homeopathy, where I found correlation while reading knowledge of Ayurveda, knowledge of homeopathy, and knowledge of allopathy. When the globules are given on the tongue, what must be happening? It's just imagination. What must be? And postulation. They go to the sensory stimuli of the cortex. Cortex gets the message, it sends to the limbic system. Limbic system sends to the hypothalamus, and hypothalamus is activated. So many a times when we get emotional trauma, immediately from cortex to limbic system to hypothalamus it goes. And from there, autonomic, somatic, immune and endocrine responses starts in a fraction of seconds. Fraction of seconds. And then the whole system starts activating. These four together is called the action of vital force. And vital force is in cortex. So the vital force, we say there is a vital force is, everybody, I used to say कि this is a vital force. अरे क्या है vital force? क्या है उसका principle? Do you know? Nothing. So then I came. I think the sale is over. It has come. How I correlated? Autonomic system, it includes physiological symptom that we call as sora. Now, unless we understand and correlate, when we are working on the diagnosis and clinical aspect, it's very difficult to understand. Somatic is syphilis, because there is damage of the cells, that is final destruction. Immune and endocrine together, psychosis. Now why immune and endocrine? If the immunity is low, hormones are released low, so low psychosis. If they are increased, we say high psychosis. And that is how once it is correlated, you will find that the things are much better understood in homeopathy. So coming to the conventional medicine versus homeopathy. Conventional medicine works on diagnosis, treatment based on common symptoms. Homeopathy considers both diagnosis and peculiar symptoms. Key learning: use partial similimum for challenging cases. That works, you can combine 2 or 3 to get the results. Because of homeopathic aggravation and final decline should not happen. Is it true or not true? Needs to be investigated. That will come after observations, keeping your mind open. And integration with conventional medicine treats the disease, homeopathy strengthens the immune system. The combined approach is effective for intractable and incurable cases. So now here I am going to show you some interesting part, which we all homeopaths, you are all good homeopaths, you are research minded, the institution is best, you are lucky to be in this institution. I feel like doing again B.H.M.S course here. It's so good after seeing the whole college. I will learn. Tiwari साहब जैसे principal you got, अभी current का मैं सब देख रहा हूँ. You are lucky to get good teachers and good institute and good institution bearers. So this opportunity, please don't miss. Be broad-minded. Try to think out of box. Apply it. See. And what is wrong is not using your own brain. There are so many schools of thoughts of homeopathy. Predictive, then Dr. Rajan Shankaran, then Delhi wale. They are right or wrong? They are right. All of them are right. All of them are right. We should not criticize. Final goal is to cure the sick. Except from this, except from this, except from this. Use your own brain and rational. In some cases, even I find that certain where this principle works, this way works, this way works, and finally the goal is to achieve. Everyone is doing good job. And there has to be a united stand, because divided we will fall. We should not restrict ourselves to anything. And we should work on that so that homeopathy comes up. Now what is this? Genomic biomarkers and pharmacokinetics and pharmacogenetics is going to change the world, and allopathy will be number one. We got first lift of the homeopathy during cholera time. During cholera times. And after that again homeopathy duped. Why? Because penicillin came in, X-ray came in, advanced technology started coming out, and finally homeopathy was down. Now this is the era which is coming up. You see, everything into genetics should be directed towards DNA and to the genomics. And from there, we have to understand, I am telling you all these people here in Father Muller College, that those who are interested in research, they should start working on this, genomics. What are the effects? Like I showed you earlier, what are the effects after you check with the EEG? There are so many instruments available now, and college is ready to spend for the good things. So start doing research at that level and try to prove what are the effects on genetics with the homeopathic medicine. If you prove that, you will be at par with allopathy. Otherwise, when this will come, you know, chemotherapy side effects, why people come to us? Because they get side effects, because they don't get permanent results, because they get other problems. Those problems are going to get solved by allopathy. Only for one thing, they will not be successful is multimicrobial resistance, AMR. And that is where, because they are playing with the nature. Here, they are going to succeed. Suppose if one person requires 200 milligrams of paracetamol is given 500. And they go into problem. So every person has got a different requirement of the power. That is milligrams per kilogram. And therefore, they are going to improve in that, and then they will flourish like anything. We get patients only when they fail there. So I'm not criticizing that survival, or on the contrary, this world cannot go without integration. Integration is so important because homeopathy also has a limitations. If you get a heart attack anywhere, your close relative, what you will do? You will pick him up and put in the hospital. I have not done that. I have seen taking a risk, not doing anything, putting in my ICU, just observing with a monitor, giving homeopathy, and what are the changes. They have improved. Only one saline, because without saline, people don't think that they are getting treated. Doctor क्या कर रहे हैं? ये भी नहीं लगा रहा है, कुछ नहीं लगा रहा है. Dr. Amarsian Nikam is doing a very good job. Pune. He has gotten 200-bedded hospital. I'm really surprised. I went to see. I said, yes, we have to praise our colleagues who are doing good job. Don't have a competition feeling with any of our colleagues. Everyone is good. We are working for homeopathy. Even if you are my enemy, I am with you. That should be the dictum. And that has to come up. So we have to direct research. Finally, what I want to say, we have to direct the homeopathic research to arrive at a simillimum in a precise way. We should be also, instead of taking 7 hours history for one patient, work this. And this is how we have to work. We have time, or we have to take a lunch break? Somebody tell me, because I keep on talking in flow, so that otherwise everyone will be hungry. 5 more minutes, no? Okay, no problem. इसको भी भूख लगी है शायद. He wants a rest. Multiple remedies debate that I already discussed. What I told you, the example that I have given with references. I am not talking in the air. I have found out references, everything. And finally, I got an answer. And then I said, no. If you are a researcher, if you are broad-minded, and you are getting failures, then you have to learn. And this has to be in a very jovial and a very common way, not taking it personally, not against homeopathy, but only for a human being. What is good for a human being has to be done, thought over, and prove it. If it is wrong, throw it. If it is right, carry forward. It's a presentation. What I have thought, unless you experiment, Dr. Hanneman has experimented and found out this system of medicine. But after sixth edition, there is no addition. No addition. Why we are stuck in that circle? Nobody wants to think out of box, go find, experiment, and find out the ways rather than just criticizing. Unless we do that, we are not going to come up front. So, we will start this case. It's my own case. And I'm going to say how a serious patient. I had an 80 oxygen, 4 patches of pneumonia, and bilirubin rising fast. Fast. In 3 days' time, it had reached to 4.8. And I was advised plasmapheresis. My daughter, she is sitting here. She gave me the protocol. I came on my senses because of that protocol. Because I told her, no one will give me the protocol. And I am going to die if I develop COVID pneumonia. Because using single remedies, I was getting failures. So for me, she learned homeopathy. And from the protocol, she brought me. And finally, when I was out, I was on my senses. I started treating myself. And this is with 80 oxygen. There are 12 allopaths in my house, family. Everyone was saying, he's going to die. She kept fighting with me. Why are you so adamant? I said, I am not adamant. Why are you so fanatic about homeopathy? Why you are so rigid about homeopathy? I say, I know homeopathy in and out, and only homeopathy can save me. Only homeopathy can save me. She said, Papa, if you die, I will hate homeopathy throughout my life. I said, don't worry, that time will not come. Only you listen to me. Don't get carried away by anyone. Don't get carried away by anyone. And I'm telling you, I have worked for 5 years in ICU. I know I'm a respirologist, ventilator manager and everything. How people die. And what stage? I'm in that stage. If I listen to you and go to there and take a treatment, I'm ready. But you give me one promise. I asked her, I told her, in that delirious state also my brain was working when she brought me out. Give me one promise. I said, yes, I'm ready to give. I am telling you, if you send me there, in ICU and ventilator will be 100% put on me. I guarantee you, 100% I'm not going to come back. But you will repent after my death that I should have listened to Papa. For that I want a promise that you will not repent. Otherwise you will suffer whole life. It is then the act of the God and destiny. And finally, my elder son, who was out of country, he called and told Aishwarya, believe Papa, he has worked so much in the ICU cases and everywhere, and he will come out. And finally, in 7 days' time, I was completely out, and 10th day, I started attending my video OPD of the patient. Patient says, क्या हो गया था सर? मैंने कहा गला खराब हो गया था. गला खराब हो रहा था, दिमाग काम नहीं कर रहा था. So they were not ready because once the doctor who is attached to the patient, patients are so attached to you. Moment they learn something, they feel helpless. And with that fear, they go into the problem. So you should think of them rather than telling them blindly, I am not available. Make some arrangements. And that is what is homeopathy. Thank you. Have a nice lunch, little lunch. Otherwise you'll feel sleepy. Thank you.
Thank you, sir. We will continue with this session post-lunch. In the meanwhile, we have a special presentation on Mind Key by the revered Dr. Jawahar Shah, a senior homeopath, technocrat, academician, clinician, organizer and philanthropist with over 45 years of professional experience descending from a lineage carrying on the legacy of 5 generations of homeopaths. A warm welcome to Rajathothsava, sir. The stage is all yours.
Welcome, Dr. Jawahar Shah. before he starts, I want to talk about him. He's a wonderful man, and he works from the heart for homeopathy. The first thing which I started, I told you, when I started my homeopathic journey, the first thing I purchased homeopath software. And then just putting the symptoms, otherwise I was referring tendon. And finally, it had helped me so lot, because it is, otherwise I had to take repertory and put 1111. So I really thank him for giving this a wonderful software to us. Thank you, Dr. Jawaharlal.
Thank you. Where is that page? वो page था ना? Program. Page, हाँ, program.
कनेक्ट करूँ सर मैं ऐसा ऐसा थोड़ा घूमिए इधर और इधर आऊँ उधर जाके और इधर
Very good afternoon. Change your energy. Come on. Very good afternoon again. Yeah. तभी खाना मिलेगा. See, होम्योपैथी में एनर्जी नहीं है तो कुछ नहीं है. Right? Yes or no? अरे बोलो यार. और वो भी पीजी वाले. See, I want to thank, there was some beautiful thing which I observed. Your director, I was sitting in the chair, and maybe because of my light weight, the chair was shaking. He got up himself and arranged for a chair. And when I look at his eyes, there was so much of humbleness and humanity which I could read in his eyes. And all of us have to have this humbleness. Without that, you cannot be a good homeopathic physician. I want to thank. It is my great privilege. First time when I came, I was invited by Dr. Tiwari to this institution. It was at the old place. And even then the energy was different. And whomever I talked in last 1 week, everybody said only one thing, that the doctors who come out of this college are fantastic practitioners. So when Dr. Prabhu called me, in 2 minutes I agreed to be here. I did not even think, So one of the rubric, if you want to see, if you want to find my repertory, rubrics and the remedy, I am always abrupt. I always believe if human mind has to work, every 5 to 10 years, you should do something different. So originally, I started my practice, okay? I started my practice. Then I started developing the software. So after 5 years, software. I started in 1980, and Dr. Jaswant Patil, he is a good friend of mine, And I love him only because of his love for homeopathy. He loves his homeopathy from heart and soul. And, हमारे दोनों में एक चीज कॉमन है. You want to know? Again, ढीला यस यार. हाँ, जोरों वाला यस चाहिए. You know, both of us were always told that homeopaths can't make money. All of you want to make money? Again, Dila, yes. Just raise your hand. Energy has to change. ये लोग को पैसा नहीं बनाने का है, घुमा जरा कैमरा. हाँ, ये लोग को सब चैरिटेबल इंस्टीट्यूट में लेके जाओ. अच्छा, उधर से ही है. ऐसा है. You know, all of us used to come and say that we cannot make money. Trust me, both of us have got something common. Both of us own Mercedes car, right? हाँ या ना? जसवंत. अभी वो सो गया, बोले बहुत बोल रहा हूँ. Trust me, I have given more than 500 seminars in 22 countries. So I want to thank Father Muller team members. They have gone for lunch. आप लोगों को छोड़ के पहले वो टेस्टिंग कर रहे हैं. See, today I'm going to talk about something very interesting. All of us know that mind is the most important thing. So what we are going to learn today, and this we have tried. There's a beautiful brochure all of you must have received. If you have not received, please receive it from Dinesh. Have you received? Yeah. It's unveiling of mind. This app is known as Mind Key. It is going to revolutionize emotional assessment with AI. And you know, we have been talking of AI. We have already entered into this. What is most important? It will allow you to understand 9 emotions in a wonderful way without even doing any of the intrusive procedures. And you can get these different expressions in such a wonderful way you cannot even imagine. So we are going to share these details. The 4th revolution, you know, there has been revolution of different kinds in our life. You know, the first was, basic revolution of using of the, different metals. Then came the industry revolution, then technology revolution. The next revolution is going to be the health revolution. And homeopathy will be playing a big role in this revolution. I have been working for technology passionately. Passionately मतलब मैं बिल्कुल पागल हूँ. For me, homeopathy comes at the top, I come at the most bottom. So it's homeopathy, then my patients, then my family, and then me. Okay? So most important thing, I have been working as a clinician. We are 5 generations into homeopathy, technology. Our software is being used in 150 plus countries. Okay? Has delivered more than 500 seminars. And I am also part of the Ayush mission for Wheels Foundation. We are associated with IIT. And during the COVID task force, we have distributed 1.5 million kits. The entire Maharashtra police was under us. Okay? So it's not ending there. What is the base? All of us know completely. वो कैमरा वाला भी भाग गया. ओह, क्या कर रहा है यार? We have psycho, neuro, endocrinal and immunity balance. The balance controls us at the physical level, emotional, intellectual, spiritual. And when balance goes for a toss, everything gets disturbed. Okay? Now, why? What do we do with this mind key? It gives an entry into the inner world, entry point in a case, deeper understanding of different emotions. This is very, very important. Study of subconscious mind. The entire study of subconscious mind comes in 1 minute, and its complete analysis with the assessment. Okay? What happens in this? You have to just face a camera with a blank screen. You know, ordinary camera, your computer camera, you don't have to do anything very specific. So no investment is required. What it does, you have to face this blank screen. Now there are 75 points. It studies from here to your upper part of the body. And it breaks it into different emotions based on your movements. And what it gives is something very interesting. It has been developed along with Neiland, and it gives you a quality. You know, the purpose is that we understand and use this to give a quality life to the patients and create healthier generations. What is Mind Key? Mind Key is a simple AI-based powered software which allows you emotional state. It is simple, quick, non-intrusive, easy to operate, reliable, and it gives you unprejudiced observation. When our master has been telling all the time, be unprejudiced observer, here is what it does. And I'll show you some of the interesting cases. You know, it gives you entry point into the patient. Means patient will say, I am not having any stress. But when you do the test, it gives you stress as one of the key factors. Patient says, I have no fear. I can go on the 10th floor and stand. No. When you do the test, you get a point of entry. Patient may say, I have no conflict in my family. But when you understand, there is a conflict, there is no love. Okay? It gives you deeper aspect of different emotions. Another thing it gives is response to the homeopathic treatment. We always say that we have to find evidence base. Okay? We tell the investigations to be done. Evidence-based homeopathy. This is the most perfect way. I will be showing you some of the cases where there is a complete shift and you can say that the patient has recovered completely. And what it is a comparative study of the emotions and also differentiating different points. 4,000 plus tests have been done on patients, practitioners, students, teachers of different disciplines. So it's not something which has come from air. And this AI model gives you the subtle changes in the upper part of the body, face and eyes. What it does, individual whose analysis is required faces a video, just web camera, no questions has to be answered. The physician asked one question, he will face this, and based on that, the report can be generated. Okay? It is totally web-based. So you don't have to do anything else. And in this procedure, there is no verbal communication required. No, you have to just focus on this screen for 60 seconds. And it goes through the entire process of technology and gives you a beautiful graphical presentation. And this is the sample. This is how the sample will occur. It will come in the form of a line graph, and it will go and come up in a bar chart. So this is the simplest way in 1 minute. Okay? Now what are the emotions? Calmness, happiness, pride, love, surprise, fear, anger, pensiveness, disgust, stress, and engagement. So these are the 9 different things which can be measured. And see this, there is a different color for each graph. Okay? And it will allow you to understand. Now, in last 6 months, we have studied more than 150 patients before, during, after, and we have got valuable insights with lot of entry point, and how beautifully it confirms. And what Dr. Kishore Mehta has to say, you know, he is a teacher of the teacher, very senior teacher and a mentor in UG and PG. He said, mind key helps to understand more precisely the state of mind and the subconscious mind. Okay? The app is something different with AI based, and it has totally changed my approach to patients. It will enhance the practice of every homeopathic practitioner more successfully without any doubt. Now this is very interesting case number 1. You can see here, there is a comparison of calmness before and after. You can see the calmness here in red and another after the treatment. And the examination is on 25th November and 3rd February. So everything is a truth. So there is nothing. And you can see the calmness change. The fear has gone down completely. And the stress has gone down. So that means the medicine which was given was a right medicine, and it brought about a wonderful change. Second, you can see the case. Again, calmness has gone up, anger, fear, and the stress has gone down. A beautiful case of bloating with dysmenorrhea, a complete shift. Okay? Now this was another very interesting case. Okay? Now this particular patient belonged to a creative industry. He is the CEO of one of the creative industry, and to our surprise, when we took the case, the only thing which was very visible was engagement and passion. His passion was so high, you cannot even imagine. And these are the people who became very successful people. From zero, from the road, he becomes the owner of 1,000 crore company. Now you can understand how beautifully. And what was the most beautiful thing you can see? His stress level, you can compare. His stress level was 0. The stress level was not there. And why? He was doing yoga, he was doing TM, and he was doing number of other activity. So the stress level was 0. Now in this patient, if you try to investigate something, oh, how much stress you are on such a big position, no impact. Okay? Now this is another case. He was a CEO of one of the most topmost company. आप उसका phone इस्तेमाल करते होंगे. And you can see only 2 things running. Passion and engagement. passion and engagement. And he is such a successful CEO, one of the phone company's CEO. Amazing. We did another test. How do you feel? We asked a simple question. How do you feel, okay, about the marriage of your son? And in that also, you can see the passion was very high, engagement was very high. Now that allows us to understand that this particular patient is amazingly committed to his job. And these are the people. So if you have to recruit the people, if you have to have your assistants, we did this kind of test with number of new recruiters. You know, new recruitment, we took the test. The bloody fool had no passion. अभी उस गधे को तुम काम पे रखोगे ना, तुमको 4 लात मार के निकल जाएगा. डॉक्टर तिवारी और जसवंत पाटिल हंस रहे हैं. They are laughing because they have experienced this. In my 45 years, I must have employed not less than 1,000 people. And suddenly you realize, you know, he says, I'm Top, I'm AK-47. And in 3 months you realize, we have paid people 5 lakhs of rupees salary per month. And then 3 months you realize that he is useless. He cannot even generate 500 rupees revenue for us. So you can understand what happens. Now another case, a singer. Singer was asked a question, simple question, how do you feel if your voice will not get better? See the stress level, see the fear level. Fear level shot up to the other level. So what I'm trying to show you that this is one of the most objective way to study. And what's Jai Patel? Jai Patel has been principal of CMP. Various points like fear, impatience, engagement, love, and even distractions can be found out. I was astonished to see the correctness and authenticity with which I could get the spectrum of the graph of my emotions. He underwent the same exercise and he was shocked. He said, how come it can give you he was a board member of M.B.B.S and many other positions. Okay, now, this particular patient had a dispute with the sister. And you can see after the treatment, before the treatment, and after the treatment, see the calmness. You know, happiness has gone down, but the stress and fear have also gone down. When we asked a general question, and then after the treatment, you can see the change which has happened. Then we go to a schizophrenic. This was a beautiful child who had come from US, and he used to see zombies. Everywhere he would see zombies. And he was under the treatment. Within 2 weeks of treatment, you can see the fear. 2 weeks of treatment, simple remedy, calcaria carb, 200, 2 or 3 doses. The complete disappearance, and this patient said, zombies have gone to Mexico now. See the shift. And another case, you can see the shift. This was a very interesting case. This girl, how many of you have fallen in love? Mangalore में permission नहीं है to fall in love. I thought Mangaloreans were more common to fall in love, huh? पानी, दारू, नहीं समझ में आया. Oh, अच्छा, देखो fall in love, it literally fell. हाँ? हाथ ऊपर करो ना. How many of you have fallen in love? हाँ देखो, दो तो है पूरे ऑडियंस में, बाकी सबका तो लव फेलियर ही है, एडमिट नहीं करेंगे. यहाँ पे मैंने देखे सबकी आंखों में लव है. but admit नहीं करते हैं. To fall in love is nothing wrong, right? What do you say? Hello? To fall in love, is it okay? आ जाना बाहर. डर रही है वो भी. Anyway, so this particular girl had fallen in love with one particular boy. They could not get along, and then she fell in love again. They separated out. So when we ask the question about the first boyfriend, you can see love is there, fear is there, stress is there, everything is there. But when we ask the question that how do you feel about the second boyfriend, the love is gone. कहाँ गया? पता नहीं. Fear is down, and even the stress is down. Understand, see how you can understand how it is objectively. She got interested, yes. That's the reality. She wanted to, really? It happened? Yes. Now, another very interesting case. Arre, don't give me yaar. I don't work with time. किसको भूख लगी है? तू जा सकता है. You know, there are days I don't eat till 6 in the evening. बस काम करते तो भूख नहीं लगती है. Okay. You know, responsibility. There was a case who took the responsibility at a young age, and you see the stress, very high level of stress. So that's the area you have to, study. Another case, very interesting case. The mother died. So you can see happiness has gone down, stress has gone up. This particular patient, mother died, and he would pick up the clothes of mother and keep on crying. The mother was 91, still the particular patient. And we gave the Netramure, and there was a complete shift in stress and happiness. He stopped crying. Okay? Another case, social worker. How do you feel about the school children? And see the happiness. See the happiness, see the pensiveness. There is a big shift. When you love to do something, when you really enjoy, there is a major shift. Another case, this gives you entry point. You can see in this case, there are different entry points, and these entry points cannot be neglected. And in this particular child, it was asked, do you love your father or mother more? Now the child went into a conflict. World of conflict is very well depicted. And you can see suddenly there was a love, there was a stress. But there was no disgust, because the child loves more. We did this experiment in lot of orphans, and it gave us a different picture. Then we did the comparative study between male and female, and there was a beautiful thing, female express more, more of love as compared to male. But they have male have got more of joy, more of anxiety and fear, okay, as compared to. But the happiness is less in female. You can see this pink. Their fear is high, their happiness is low, calmness is high, and the stress is high. So on an average, men are less stressed than female. Shailendra Vaishampana, he said before starting homeopathic treatment, it could have analyzed, and the treatment can give you much more detail. So it will help you to enter. What is the conclusion? Mind key is a reliable tool to assessing emotions utilizing based on artificial intelligence. And what we are going to offer you, there is a beautiful small little form at the end of it. Okay? Just fill in this form and leave it at the counter. On the back side there are some references. Give others references also so that they can also benefit. And we'll give you this for trial in your clinic, in your college, in your hospital. And where is the secretary? Secretary is also gone. Who is the secretary of this conference? क्या नाम है उनका? हाँ? Shreyang. हाँ, I have been talking to Shreyang since last so many days. हाँ, come. Come here. See? He is going to live 100 years here. Give a clap for him. We hardly work, he always works. Shreyang called me up few times and he said, do something for the college, right? You said that. हाँ बोलना जोर से. खाना नहीं खाया तूने भी. So he said, give a special offer for our students. So what we are going to give you, Firefly. He said, Firefly is the best software. And I'll tell you, if you are asking me, मेरे 45 years of professional career में, what is the best thing I have created is a Firefly software. And he said, do something. So what we are offering you is some discount, because I don't want to give you too much of freedom. It's just small amount which you are paying for this Firefly. Along with, we'll give you 15,000 worth, absolutely free. It's the base lecture on base series, Soul of Repertories, which gives you 33 lectures, and you will understand about small repertories like, asthma, Fatak. You'll understand big repertories like complete, synthesis, boning ocean, NAIR, how to use these repertories, what rubrics to select. Okay, so this program worth 15,000 is going to be free absolutely when you book today. It's offer first time in the history we are giving only because to celebrate your 25 years of celebration. No. How do you find Firefly? Just that.
I talk in that, no problem.
Okay, you use that. He likes his old girlfriend. Doesn't want to try with new one.
I had spoken to Sir some days back, so he was asking about the utility of his software. Firefly is something that we've been, at least me, I've been using since 4 years now. So I was congratulating him for such an extensive, very well-designed software that helped us not only in our practice but also for our studies. So once again, thank you, sir, for the Firefly software.
It can work when you are on vacation. It can work in the basement. It can work on, because you don't have to be dependent on net. It's absolutely native to the software. So friends, I want to thank all of you for being patient, and now you can enjoy the lunch. Thank you.
Thank you, sir.
अभी कैमरा उधर घुमा यार, ताली उधर पड़ रही है, मेरा मुंह को क्या देख के करेगा, और एक बार ताली हो जाए.
Thank you, sir, for your enthusiastic and innovative session on.
अरे सबके लिए लड़की बोलती है, मेरे लिए लड़का बोलेगा? क्या है यार, इतना हैंडसम बन के आया हूँ, कुछ तो दया रखने की ना.
Thank you, sir.
Thank you everybody, enjoy.
Thank you, sir. Thank you. We will now break for lunch. All the delegates are requested to assemble back in the auditorium by 2:15 p.m. Lunch will be served in the food court.
ये ले तेरा gift.